Welcome to another edition of Back Talk, brought to you from the Southeastern Studios in Mount Pleasant, South Carolina. Each episode, you'll hear from board-certified physicians as they explore the latest in medical procedures that are now helping get more and more people out of pain and back to their active lives.
Dr. Plunkett and I are sitting in Southeastern Spine today, and we have some updates on spinal cord stimulation and just stimulation in general with some new options for our patients. And Dr. Plunkett's going to talk to us about some new indications for spinal cord stimulation that opens up a whole new patient population for us to treat.
Yeah, with the name Southeastern Spine, certainly you've seen a lot of patients who have had a long history of back and leg pain. One of the new things that a door's been opened is with approval for peripheral diabetic neuropathy. We have a lot of patients who have been suffering from diabetes for a long period of time, and one of the consequences of diabetes is damage to the nerves down in the feet. And so one of the challenges in managing the peripheral diabetic neuropathy is there aren't a lot of good options.
A lot of medications that have really bad side effects.
Yeah, right. And so a lot of patients who have been on medications that make them tired or sleepy or confused and can be very challenging to help with the pain that they're experiencing on a daily basis. And so one of the nice things that we can utilize is something called spinal cord stimulation, which itself as a therapy has been around for a long time, but the FDA has come out and approved spinal cord stimulation for treatment of peripheral diabetic neuropathy. And we've seen some great results with patients come over, have the therapy placed through a minimally invasive approach, and within several days are walking for much more prolonged periods of time and able to do things they haven't been able to do in years. And the quality of life and satisfaction that they've achieved is remarkable. And again, when they've been dealing with this pain for years and years and years, and have tried many different avenues to alleviate that pain and have had no success, this is really a big game changer.
I think something you just said is what we want to highlight here with the video is that this is minimally invasive. This isn't a big back surgery. There's no screws. There's no rods. It's a reversible procedure even if it needs to be. And so we're going to play a little bit of an animation of how the stimulator goes in. And the stimulator really just goes in the same way an epidural goes in for a patient who's pregnant and about to have a baby. The wire is just placed just between the bone and the nerves. And instead of squirting medicine in that area like a regular epidural would do, we're just using a minute amount of electricity to disrupt those pain signals that are coming from either the back, the legs, and now with this new indication from the feet. So easy to do. Option for a lot of patients with minimal side effects.
Yeah, one of the nice things, patients are often fearful and questioning whether undergoing another surgical procedure is the right answer. And I think one of the nice parts is that it requires minimal anesthesia. It's something that, we do in the same area where we do more simple injections. And it's certainly a nice option for those who have been trying for a long period of time without success to get control of the pain down in their feet, the numbness, the tingling that has prevented them from getting up and walking around.
So speaking of new indications, we have Medicare has approved a different type of stimulator to help with some other types of pain that a lot of our patients have been experiencing. And so pain from arthritis is often difficult for us to treat if the patients haven't responded to our traditional therapies like medial branch radiofrequency ablations, which is where we cauterize the nerves that go to the painful joints in the back. Or if patients are looking for something just a little more simple, we've got a novel solution for that. So there's a company called Nalu. They have what's called a peripheral nerve stimulator. It looks pretty similar to the spinal cord stimulators, but it's actually less invasive. So what we do for that, let's say a patient has had pain in the lower back due to arthritis of the joints between the vertebrae. Those are called the facet joints. We can simply take this wire down, slide it up next to those joints, and turn on a little bit, again, of minute electrical stimulation. It's going to treat the muscles, the nerves, the joints, all the structures in that area, and can alleviate pain for those patients. Another great thing about this new device is there's really not a big battery that goes with it. So with most stimulators, there's an implantable battery that goes up under the skin. And with the new device, this battery just has a little receiver. And so again, it just kind of tunnels right up under the skin, and the patient can feel where the tip is, and then they use this external battery to run it. So it has the capability to run 24 hours a day if needed, but also removable for swimming, showering, any activities. Most patients we're finding don't even need to run it a full day. They get up in the morning, maybe the pain's gotten worse a little bit overnight. They put their battery on, run it for a little time during the morning, and then they feel pretty good to go about the rest of their day. If that pain were to rev up or get exacerbated by something else going on, all they got to do is put that battery right back over it and turn the therapy back on. Another beauty of this therapy, reversible. If these wires ever needed to come out, they're just easily removed through a small incision in the skin. So we think this will be good for our patients with ongoing arthritis pain who haven't responded to other treatments, or maybe have gotten tired of trying different medications with bad side effects that maybe even be contraindicated because of heart disease, kidney disease, those sorts of things. All we're using here is a little bit of electricity to treat muscles, nerves, and joints.
Ryan, that's a great demonstration of some great solutions to help with long-standing pain that's been difficult to treat. And I just wanted to take a second to thank you for coming by and showing me how that works.
Yeah, no problem. Also, great to hear that we've got some new options for diabetic pain that's not medications, that's minimally invasive, and can help patients out who we weren't able to help as much before.
We hope you enjoyed this edition of Back Talk and learned something new. Look for other podcasts from Southeastern Studios as we explore the latest in medical procedures that are helping more and more people living in pain get back to their active lives.